Good evening, everyone. Welcome to the wonderful session this evening. It's an holiday for us, so everybody's at home enjoying the holiday. You're all welcome. Okay, today is another episode of the live session of Ask the Pediatrician, and it's on mental health. We'll be discussing that today's World Mental Health Day, though, so it's an avenue and opportunity to discuss that to the fullest. I welcome every one of you to today's session. You can invite your friends, your family, your loved ones, your next door neighbor. Everybody should come on and listen, have a feel of what we are about to dish out today on World Mental Health. And the person that is going to take that is no other than our very own CEO, Dr. Gbemisola Boyede. She'll be the one to take the session, the live session, discuss extensively. If you have your question, drop it in the chat section. We'll read it out and answer as much as we can before the end of the program. Once again, welcome everybody. Sit back and have a full of the session. Dr. Gbemisola, you are
Yeah,
welcome, ma.
thank you, Gemma. Good evening, everyone, and welcome to ATP Live Monday. I think it's been quite a while we did ATP Live, and so it's good to be here today. Thank you so much, everyone. So, for those who are watching on Instagram, you are welcome. I hope you can see me, you can hear us. So let us know that you are there. Welcome. And today is World Mental Health Day. So, World Mental Health today is about making our mental health a global priority. And so, if you also have questions on mental health issues, you are welcome to share them. And mental health is not something only for adults. It's something that can also affect our children, our teenagers, our adolescents. So, yes, we should be concerned about everybody's mental health. But all the same, we're still going to draw our usual thing, answer any questions that you may have on health issues. So, feel free to drop your questions and Ijama reads them and I will answer them. And we're going to answer those of you who are also joining us on Instagram as well. We'll kind of switch in between the two. And that's what we're going to do. So, welcome and happy holidays for those of you joining us from Nigeria. I hope you're having a wonderful time. All right. So, we're going to start. But before we start, let's just make sure that the videos are all in our various groups and everybody can see them. So please share the video yourself. I'm also checking and making sure the videos are pinned on our groups and everybody can see. I'm trying to just check that. Okay, we are live on Ask the Pediatricians Facebook group. Okay, so let's all share the videos and let's start dropping our questions as well. All right, so see. I'm checking the groups and making sure everybody can see the video. Okay. Do we have any question yet? Not yet. So we're just making sure the videos are shared and everybody can see it first. So then we can continue from there.
Good evening, Carmen Camilla. You're welcome. Good evening, Carmen Camilla.
Okay, I think we have. I think we are good to go. I think all our Facebook group can see the videos now. Yeah. Okay. Yeah, Carmen Camilla from UK. Wow, welcome. Thank you so much for joining us from UK. I hope it's warm where you are. Thank you so much. All right. So while we're waiting for people to drop your questions, and we'll just use this opportunity to talk a little bit about mental health. And for us, especially in Nigeria and Africa generally, when people hear the word mental, we tend to associate it with a lot of stigma, as if it's something to be ashamed of, as if it's something to hide. In fact, people will make joke or will make fun of people and say you are mental. That as if that means that you are not okay upstairs, or you have something like a health issues, like psychiatric issues, and that you should be scared or you should be afraid of that. I think we need to demystify the word mental. The word mental just mean mind. So human beings, we are made up of our brain, our body. Then we also have our mind, which is where we think and all that. So the same way we can have physical health issues. So some of us are using glasses, some of us have issues with our maybe blood pressure, diabetes, and all that. The same way people can have issues also with their mind. So and there are a lot of them. So it's not everybody. It's not only those who have what we call psychosis. That is what people tend to refer to as being mad, or people who are roaming the streets, or they who are taking off their clothes. So that is the idea people have when they hear the word mental, or when they hear the word when they hear that word, that's what they think. Like somebody is mental, somebody has they are running mad on the streets, and some of our own videos as well. That's the impression they always give. No, so when we talk about mental health, it is more than that. It has to do with having a healthy mind. In fact, the fact that if you are really always stressed, like you're always anxious about issues, you see a mental health thing. If you're always scared of, something's going to happen to you, and that kind of fear and all those, it's still part of mental health. If people that are depressed, they are just sad for no reason, it's part of mental health issues. So it is not only when people have what we call schizophrenia or psychosis, the one that maybe people think that's when they have to go to psychiatric hospital. That is when we're talking about mental health issues. No, people that are thinking of even killing themselves, suicidal ideation, and all that, it's still part of mental health. So the first thing when it comes to mental health is that we need to demystify it. We need to remove the stigma around it. We don't need to make it sound like it is something to be ashamed of. If you are struggling in that area, it is just like any other health issues, and we have to look for ways to make sure that our mind, because there are a lot of things that can stress us, there are a lot of things that can tip people over. Of course, some people already have that maybe genetic tendency to have some mental health issues, or it can run in some families. But there are other mental health issues that are not necessarily what most of us think as mental health issues, but they are still part of mental health issues. So, and there's no reason why anyone should be, stigmatized or feel like, oh, I can't talk about the fact that I have a mental health issue, which is just something that we should all prioritize. And that is why some people suffer in silence, and that's why some people don't, in some parts of the world, if you say, okay, maybe people want to go and see a psychiatry or something, they see it as a mental health worker. They see it as a stigma, as like you, well, what is wrong with you? Why do you need to go and see a psychiatrist or something? No, there's nothing wrong with it. These are all professionals that work in the mental health area, and they can help us with our mental health. So we don't need to stigmatize mental health issues. We are all part of it, and we should all support each other. And if you know somebody is struggling with their mental health, it's not to stigmatize them or make fun of them or make jest of them. And it's not to think, oh, maybe it's a spiritual attack, or some of these things are just medical issues as well. And all we need to do is to get the right support, and there are different level of support. So there are support groups, there are mental health professionals that can provide support for us. So if you have any of these issues, you're always thinking of, maybe I'm going to kill myself, or always thinking of, you're always anxious, you're always scared of everything. So those kind of things. So for example, mothers, let me come home to my area. New mothers, sometimes you start feeling so sad. You just had a baby, but instead of you to be feeling so happy, which is what we normally expect, you are feeling so sad. What that one called baby blues is still mental health issues, and you need help. You can get help for it. Or some people have even they are depressed. Sometimes they even think, maybe I should kill this baby or something like that. It can happen. It doesn't mean you're a bad person. It's just the mental health issues, and you can get help. Some even have frank postpartum psychosis as well. So these are help that we need to get for our mothers or even our children. Sometimes they too can have anxiety. Sometimes they can also be depressed. Some they can also have mental health issues as well. And when they tell us, let's not just shush them away. Let's try and understand what is going on. Why are they anxious about school, about going to school, or about meeting some particular people? You need to understand and then see whether we can give them some help. So, in summary, it's the World Mental Health Day, and it's just to remind us that when it comes to our mental health, it has to be a priority for everybody, and it is not something we need to remove all the stigma around mental health issues, and we need to make sure that we support everyone and we give them the right support that they need, or let them see the right professionals to help them navigate the journey if they are going through any mental health. In the meantime, there are many ways that which we can maintain our mental health well-being. So number one, we should eat well. Okay, some of us are stressed about our weights and all the eyes and all that. Sometimes just eat healthy, drink a lot of water. Sometimes hunger, when you're hungry, is going to affect your mental health. So make sure you eat healthy, sleep well. Sometimes it is lack of sleep when we are so stressed. I know some of us living in Nigeria, we live in a very stressful, we go through traffic, all those things are stressing us. We don't know. And most of us don't even understand the concept of taking vacation or holidays. You don't have to travel out of Nigeria to go on holidays or to have some to just have a break, a rest. So you can structure it. That's why we're supposed to work 6 days and have one day Sunday for free. But even in our 24 hours, we can have one day that you just rest and you just do what you like. So you must all have hobbies. Every day is not about running after money, naira and kobo. Let's have period each day, even if it's 30 minutes, even if it's 1 hour, that you do something you just do for enjoyment, whether it's just to listen to comedy stuff or to just watch a movie or to read a book or just do something that just relaxes you, that is not something pressure. Just forget all the deadlines, do something nice that you just enjoy. Let's hang out with people, friends and all that also help with our mental health. Let's drink a lot of water. Let's have vacations at least in a year, not every Monday to the 52 weeks of the year. It should not all be work, work, work. So we have to be intentional about taking time for our mental health. And let's always have the concept of circle of influence and things that are out of our control. So there are things that were inside your control. So there are things you can do. Maybe if you want to take a cab or you want to take a bike to work, it's inside your circle of control. Whether you want to eat rice or you want to eat beans, it's inside of circle of control. But there are some things that are outside of our circle of control. There's really no point with stressing ourselves over here. Some of the political issues we all fight ourselves over, it's actually outside of our control. You just go and vote and hope the other person does the right thing. So things that are not within your control, just let them be and focus on things that you have control over and that you can make changes about. So these are a few tips to make sure. And next, I know spirituality is also very good. So for those of us who are Christian, you pray, you meditate on the Bible and all that. So if depending on whichever religion you practice, all of them have things you can do. It's also a way of helping our mental health and keeping us you know uh, maintaining a good mental health well and well-being. So let's make sure we structure all these things in it. And if we think we're doing all the right things and we're struggling with some issues, let's not be scared or be ashamed or be anxious to ask for help. Please go for help, ask the right professionals. And this is a time of social media. There are lots of online support groups and so things you can even do anonymously. There are phone numbers you can call, and of course there are how hospitals are there. So let's make sure that we get this help. And I know that we all should have we should all see that mental health or mental well-being is our priority, every one of us, and we should also look out for each other as well. So I think that will just be my overview as far as mental health is concerned, and then we can now go on and start taking our questions and answers. So you can ask your normal pediatric child health related questions, but you can also ask questions on any issues maybe relating to mental health. So I think we have a few questions from Carmen from UK. Uh, okay, Camel is Adab, are you there? Okay, I think my moderator is freezing. It's frozen. Okay, so Kamel say, good bless you for this topic. I'm happy to see that people are becoming aware about this in Nigeria. Yes, we have. We have to be aware of mental health issues. So it's not just only those abroad that has it. It's all over. It's a global thing, and yes, we should all be aware of it. All right. Yeah, the male gender needs to be more open and admitting that they also need help. Yes, you are right. You are right, Kame, because men are in Nigeria, in Africa, our men are raised to believe that they are very strong and men don't cry, men don't show emotion. And yeah, but really, a lot of men are suffering and they are really struggling with their mental health despite all the because of the way we're raised. I think it's time we start raising our children differently for our own generation. We need to start raising the guys differently and let the boys know that it's okay to show emotion. It's okay to be angry. It's okay for a man to cry. It's okay for them to ask for help if they need help. They don't have to be too strong and all that. So yes, men too needs the support. Adaku, are you there? Okay, I'm not sure why she's looking as if she's present. All right, so thank you, everyone. I can't see any questions today. I guess it's a public holiday, so I guess many people are not online today. Okay, that was gone. I hope she comes back. But please, if you have questions about the health of our children, don't be taken aback by the fact that we started with the mental health preamble. It's just because today is World Mental Health Day, and we normally always talk a little bit about it. So we could have actually restructured today if we know it's a public holiday, but I just realized it's a public holiday now. So, but we are here already. So if you have any question, please ask question. Okay, Carmen is asking, in your opinion, do you think mental health can be treated fully? Yes, why not? It depends on the kind of mental health issue. So the mental health is a big umbrella. There are many issues that come under mental health. Some of them even go on their own. For example, people who have anxiety and all that, sometimes they can there are lots of therapy, talking, even just talking to people and walking through certain steps, they can get over some of these issues. People who have addiction issues, they can also get over it as well. Of course, there are some conditions that require medication. Some people have like depression, psychosis, and all that. They may need medication before they can get over it. So it depends, but generally all of them could be managed. Some of them are not like you're going to be completely cured or something, but a lot of them too you can get over them, or at least live a very productive life no matter what the mental health struggles is. Of course, those who have very severe struggles may need more support, in-house care support and all that, but majority of people don't are not in that category, and many people actually get over them. And some mental health issues are transient. So like baby blues, for example, for new moms and things like that. Within 2 weeks, they are gone. So it's not something that will go on forever, but they just need to make sure they get the help that they need at the right time. Thank you. Thank you, Kame, for joining us and for your contribution. Chibuzo Ifeoluwa, good evening, Doc. What could make a 23-month-old baby not to choke? Oh, he only say a few words like "stop it," "I'll beat you," "take your time," and he also imitates words, run errands in the house, also plays the laws, whatever. Whenever I want something, goes to bring it instead of communicating. Okay. Oh, thank you, Philua, for your question. There are many possibilities here. So this child obviously has speech delay because a 2-year-old should be talking, should be using their own words, not just echoing other people's words or using words that they have learned. Because most of what you have written here are what we call stereotype words. They are things the child has had other people said, and it's just repeating it like a beat you, take your time. You or somebody else must have said those words around the child. So the child is repeating them back, So we're definitely going to be concerned about this child who has speech delay, who is echoing words, who is not using the words to communicate. So you definitely need to take this child to see a speech therapist. And more importantly, we may need to do what we call autism assessment as well, because these are some of the things you wrote here, red flags for autism, and we may need to do a proper autism assessment so that we're sure. Usually autism, in autism spectrum disorder, there are lots more repetitive behavior or or some uh, um, peculiar way of doing their own things. That's what I'm going to put it. And so for such children, they need assessment, but with the right support, therapy, speech therapy, behavior therapy, they can get they can talk, and then um they can get right support. So Chibuso, the first thing I would recommend is that you should see a speech therapist and a developmental pediatrician. So speech therapy are going to help you with therapy, but the diagnosis has to be done by the pediatrician. So you definitely need to see a developmental pediatrician for that aspect. All right. Ijoma, are you back?
Yes, I'm back. Sorry about that.
Okay. You were frozen at some point. All right.
Nigerian
So
battle.
let's ask our question on Instagram. I can't see people asking questions, but I believe you're following us. Okay, can you read the next question for us?
Okay, my baby has running nose and teary eyes. Noticed it 2 days ago. What could cause that?
Okay, so the question is not very clear. So just to remind us, when you're asking question, I'm not seeing your baby right in front of me. So it's very important that you tell us the age of your baby. And so that will be very helpful. And um, as much details as you can provide. So this Facebook user, I guess, is somebody from our Facebook group, because we can't see your name. Do you mind telling us the age of your baby? And let us know that. That's number one, because the causes of conditions vary depending on the age of the baby. So maybe who have runny nose, have teary eyes. Um, runny nose is like what we call catarrh. It could be acute infection. But if the child is also having teary eyes, then you wonder, is it like the child having like allergic reaction to something, or is this child having a viral infection? There are many possibilities. So you have to give us more details, but you can just watch. And because if you say like allergic reaction, it will stop on its own as long as the child is no longer exposed to what is causing the allergy. But if it is something else, then you may need to take the child to the hospital for proper evaluation. Okay, so let's move on. Okay, I think Kame is still continuing the
Comment
conversation. Yeah, the conversation we're having about mental health, and yes, learning disability. Yes, people with learning disability can also have mental health issues as well. And yes, it's possible. Thank you for your contribution, Camille. Okay, another Facebook user say, "Good evening, Doc. I'm watching from Qatar. Thank you." It's like it's only people from UK, Qatar that are watching us today. The Nigerians are enjoying the holidays. All right, thank you for your guidance and a good job. What can make a 43-year-old woman lose focus sometimes or confused when reading or having a long condition? A long discussion. Sorry, I beg your pardon. Okay, it started recently. Okay, so this needs to be further teased out. So the first thing, if you ask me if it's in my children, the first thing that will come to mind is somebody who is having a convulsion, because when people have convulsion, it's not every convulsion where people are checking and all that. Sometimes some convulsion is because they just, they have what we call absence issue. They kind of lose focus of their mind, and then they just come back again. So it can happen like that. But because this is an adult, I really need to be sure. We need to do a lot of tests. We need to check, is the blood sugar low? Is the even mental health issues that we're talking about here can cause that as well. So we first have to first decide whether is this something physically wrong, like maybe low blood sugar, maybe the person becoming dizzy or something like that. We need to check physical health issues. Then we need to check things like mental health issues and all that, especially when confused and all that. We need to really know. We need to be sure the person is not having a stroke. Sometimes stroke can present that way. People just become confused and all that. So for this doctor, I really recommend that this 43-year-old woman should go to see a doctor. So they will ask a lot more questions, examine her, do blood pressure, do a blood sugar, do so many tests to be sure whether it's a physical health issue. We may even need to do a brain scan and all that, EEG. There are many things we need to do because there are many possible explanation. So we need to know which one it is. It is when we know which one it is, then we can now recommend appropriate treatments. So I hope that's helpful. I think Adako has disappeared. Hopefully she'll come back. Somebody said my baby is 4 months old and pull like 5 times a day. You've not asked any question. That is just giving me information. And there's nothing wrong with a 4 months old baby pulling 4 times, 5 times a day. Baby can pull up to 12 times a day. The most important thing is whether the pull is watery or it's normal stool. So whether a baby pull 20 times a day or not, as long as the stools are normal stools, there's really no need for you to worry about it. That is normal. And for your 4 months old, all we want you to be giving the baby is breast milk. Okay. So when you are asking questions, please ask questions. Don't just give information and leave it hanging. We won't know what you want us to do with that information. So you really need to be more specific and tell us what exactly you want us to do with your question or the information that you've given to us. All right. The next question says, good evening, ATP. I noticed my daughter clocked 9 months old today. Okay. It's having discharge from her left eyes with tears. Okay. What kind of discharge is she having? So you have to be more specific. Is she having like pores, like whitish or yellowish discharge? And I've been cleaning with wet towel, but after her nap, I noticed it has covered her eyes. So plus she's teething, she already has two at the down gum, she has been rejecting food, she only suck little, and this has affected her weight a lot. Okay, how long has she been having this issue that is affecting her weight a lot? Because I think all this, you didn't tell us when the discharge and the teething and everything started, so it's difficult to say. I'm so troubled. Happy first time mom. Your baby was 1.7 kilos. So your baby was a preterm baby, or I guess, or is it small for gestational age baby? At 6 months, 6 kilos, 7 months, 6 kilo, at age 6 kilo. Why is your baby been static for 3 months? That is worrisome. So you've taken her to the hospital, okay? I can't see the rest of your. So the story is so long, all right. So, but the good news is that you ended with the fact that you've taken this baby to the hospital, because number one, I'm worried about the weight of your baby. Your baby was a small for gestation, or low birth weight baby. So you need to tell us how many weeks was the pregnancy when you had your baby, because we need to calculate the corrected age for the baby. That will help us to know what we should expect our weight to be now. So that is number one. So I can't even comment about the weight without knowing how pretty, whether the baby was born preterm and how preterm the baby was, so that we can know what is the expected weight. But then, no matter what, the baby should not be static for 3 months. So 6, 7, 8 months, baby has been static, and now the baby is 9 months today. So what is the weight today? We don't know. So we really need to have all this information at our disposal to be able to help you. But most important thing is that you're taking your baby to the hospital, because this baby is obviously sick. This baby is not gaining weight. It is not because of the teething, baby is not gaining weight. So the baby has been static for 3 months now. So that has to do with sitting. And so the question is, why is baby not gaining weight? Why is baby not eating? Why is baby having high discharge? This baby is on the weight. If we assume the baby was a 9 months old baby, should be weighing like 9 kilos, so baby is weighing 6 kilos, that's on the weight. But then I don't know whether the baby was preterm, so I want to correct for the age of the baby. And more importantly, the eye discharge also need to be, so this child needs to be in the hospital. But unfortunately, we can't see the rest of your posts, so we don't have an idea what exactly happened in the hospital. But I want to trust that your doctors have done the needful. So if you are still watching us, just put the rest of the post so that we can see. But just go straight to the point, because if you write too long, Facebook just cut the rest off. We can say it. All right. So okay, well, I want this question. I think that's the person who is from Qatar. We asked about for 3 year old. I would just say don't make assumption about the person thinking too much, because again, that is another way people, every explanation for mental health, people say the person is thinking. If somebody say is having some money, why are you thinking? Kí ló tó ń ronú? Don't má ronú. You know, that's your typical response for every mental health issue. Every mental health issue is not because you are thinking. Every mental health issue is not because you are thinking too much or you are stressed. Some of them you have no control over it really. It's not, you see people that are, they have everything going for them, happy life, happy children, everything. But yet they are having mental health issues. So it is not about the fact that your circumstances or the fact that you're saying you may not be thinking about anything and still have mental health issues. So don't make that assumption. That's one thing we always try to avoid as doctors. Don't make assumptions. I really want that for 3 year old to see a doctor first. I want to be sure the person is not having low blood sugar. I want to be sure she's not having a stroke. I want to be sure those are more important things first. So let's deal with the physical, because physical health issue we can even really quickly deal with that one. Then we can now also now look for mental health after we've made sure that physically everything is fine. She's not having convulsion, she's not having a stroke, she's not having low blood sugar like diabetes. Sometimes that's the first way people will know they have diabetes, by getting confused because their blood sugar drops or the blood sugar is too high. So those are the things that we need to sort out first. So please don't assume. Do as I've advised. This person needs to see a doctor who needs to do a thorough, comprehensive evaluation, and then we can take it up from there. All right. I don't know whether Jeremiah is back now. Um, well done, Doc, and all the admin. Thank you. Okay. Somebody said most likely the woman is having mental health issue. I don't know. Maybe somebody else is making comments. Please don't comment on other people's questions. The question is directed to the doctor, so we'll deal with that. Are you back now? Okay. So let me just go to Instagram. I think Instagram people have dropped one or two questions. Um, I just want to make sure I didn't miss anybody's question. Bell Bellisunga. Say, evening doc, my 6 month old baby just started him on solid. Good. Hasn't put for 4 days. So what solid did you start? It drinks water well and I give fruits intermittently. Is it normal? So your 4 months old baby should still be on breast milk most of the time. 80% of the time baby should be on breast milk as you are introducing the solid. So this solid you are giving, what is the solid? I need to have that information. But make sure you give soft solid, either as porridge or purees. It must be soft, and the quantity, it should not be more than about 50 mils So that's it, like half a cup. That is a quantity, and twice a day. That is all that a 6 month old needs to take. Of course, maybe should drink water as well. But more importantly, that baby should be on breast milk 80% of the time. So when you are starting complementary feeds, you don't reduce breastfeeding. It is not a replacement feeding, and I don't. Sometimes mothers consciously or unconsciously do that. So they think that instead of giving breast milk, I give the solid. Then that baby doesn't need the breast milk. Or so we just give the breast milk in between a little. No, you should be breastfeeding them as much as they were before, as we're giving the solid, and the solid has to be soft porridge, and the quantity matters, the frequency matters. Don't start giving them solid every 3 hours. No, that's not the idea. Okay, and then make sure you give them water to drink. So that's that. So ideally, they should. Some babies don't move their bowel every day. That's not the issue. But then when they eventually move the bowel, the stool will be soft. So if your baby normally don't move their bowel, if your baby does not move his or her bowel every day, that's fine. There's no reason to panic or to worry. But if your baby has been moving the bowel every day before, and now that you've started solid, baby is now changing pattern, and now for this no movements of bowel, then we'll worry about that. So we have to be sure the baby is not constipated. And I think I just did on the podcast, we did something on constipation. You may want to listen to that podcast and just make sure you're doing the right thing. But the most important is first that you're doing the complementary feeding right, and then every other thing else will fall into place. So I can't say whether it's normal or not or abnormal. It depends on whether the what is your baby's bowel movement pattern on a good before the solids, and the stool had they had or normal stools. So if they are normal stools, doesn't really matter. There's no need to worry. But if your baby is struggling to pass stools, or the stools are very hard, coming out like pellets, and or very hard, like with a lot of comb, um, like add solid with you know spaces around them like a corn, like the comb of a corn, then you will worry about constipation, and that is where we now need to check what exactly you are doing. So I hope you will think about that and let us know. I hope you got the right answer. So somebody else say, Oluwa Folakumi, well done, Dr. Wemi. Is there a test to confirm mental illness? It's not a test like malaria test. It's not like blood test. So, but and like I said, there's no one illness that is mental illness. There are a lot of them. So even anxiety disorder is a lot. Depression is a different group. Psychosis, schizophrenia. There are many mental health, even addiction to alcohol, addiction to drugs, they're all mental health issues. So there are ways by which doctor will diagnose such condition. It's not by blood tests, but there are questions we will ask you, and if you seek certain number of criteria here or there, there's a way we will know that yes, you have a mental. So mental health can be diagnosed by the mental health professionals. They have their own ways of doing the assessment and doing the diagnosis. It is not by like blood tests, something like that. So if you go to all those people that will say you are putting your hand in a computer, or they are reading your this thing, and then they are telling you have this, you have that, those ones are all lies. That's not how mental health issues are diagnosed. So I hope that's helpful. All right, let's go back to Facebook, Instagram. I don't think we have any more questions. Feel free to ask your question. I'll answer them. Okay. Okay. I don't think we have any new question on Facebook as well. We don't. We still don't. Those who ask questions
None.
and ask question partially, you may want to update your question. Okay, we have one question now.
Okay. Good evening, doctor. If the stool of my baby becomes more frequent than before complementary feeding commenced, for example, between 3 to 5 times a day, and not sinking into her diaper, is this normal?
Yes, it is normal as long as the stools are not watery. If the stools are not watery, we don't worry about whether it's 5 or 10 or 20 times. The key thing when it comes to stool issues is the texture of that stool. That's the key thing that parents need to know. Is the stool watery? Is it hard? Those are the two things. If it is watery and frequent, then that is diarrhea. If it is hard and infrequent, that is less less than usual, then that is constipation. So that is what the pediatrician worry about. So as long as the stools are normal stools, whether they are passed many times or passed less frequent times, but they are normal stools, they are still normal. We are not going, in other words, they are normal texture. We were not going to worry about that. So I think that's just the, a lot of parents worry about the number of times. As long as the stools are normal, the number of times passed is irrelevant to us. So that's okay. I'm going to answer one question, and I remember I wanted to actually give a a public announcement before, but I've remembered now. Just remind me if I forget again. All right. Gift tester is saying, "Thank you, doctor. My baby pushes pull like an adult." I'm not sure what an adult push moves. Okay, but the schools will still be watery. Exactly. So the fact that babies make all these grunting noises and pushing noises, it's just drama. It's just drama. What is also matter is the stool. So the fact that baby grunts and make noises, and eventually they pass stool that are not hard. We are not worried about that. So don't need to worry about it at all. Um Yeah, so that pushing, babies do that a lot. They make all those sounds, but when they pass the stools are soft and not hard stools. There's no, just ignore the sound. There's no need for you to worry. It does not mean they're having constipation. It is when they are struggling making the sound and the stools are also hard, or the stools are coming out like round pellets like that, very dry. That is when I will worry about constipation. But all those sounds, there's no need to worry. And yeah, you should continue exclusive breastfeeding. All right. Okay. So before we continue, I remember I need to make a public service announcement. So the WHO has come out to declare that in currently in Gambia, 66 children have died, and 66 children died because they have what we call acute kidney injury, aka just kidney failure. And why were these children having kidney failure? Because they were taking some cough syrup, and this cough syrup have been contaminated. This is not the first thing this time this thing is happening before. This has happened before. It's happened before in Nigeria, in I'm trying to remember the year now. I think it's a lot of years. I was still a resident doctor then. If you just Google my Pekin story in Nigeria, we actually have similar incidents in Nigeria then, and a lot of our children were dying from renal failure. We have to dialyze a lot of children because they took, that time it was a teething mixture that was contaminated with this is what we call methanol. There are some products that people use in those who work with cars and all that. So, and sometimes people that are producing drugs in, especially from all these countries where there's no standard and all that, they can get those products contaminated. And when children takes them, it's odorless, you won't know they have been contaminated with that poison. Children are going to have renal failure and they're going to die. Now, a lot of 66 children have died in Gambia this year from taking contaminated cough syrup. So WHO has spring out a notice, and I want to let all the mothers know, those who are listening to me, please listen well, and please tell your friends, stay off cough syrup. Stay off cough syrup. I know it is in Gambia now, but these products were manufactured in India, and the main target market for those drugs are Africa. And I know that most of them are going to find their way into Nigeria. We all know that's going to happen. So please don't give your children cough syrup. Before, pediatricians like us, we don't like cough syrup anyway. We always recommend that you don't give cough syrup. Most parents always ask me, they always ask me that question every time when I say don't give cough syrup. Like, then what shall we give? But the treatment for cough is actually not cough syrup, all right? Cough is a reflex, okay? it is normal for people to cough. Everybody coughs. No, now it's only become an issue for you when the children are coughing continuously, persistently. Now, the question when children are coughing is not cough syrup. The question is what is making this child to cough. That is actually what you should be dealing with. It is just like taking paracetamol when you have malaria. Paracetamol is not the treatment for malaria. It will only reduce your fever, but it doesn't take away the cause of that fever, which is the malaria, which you have to take anti-malaria for. Exactly the same thing when it comes to cough syrup. So when children are coughing, the question we need to answer is why are these children coughing? Okay, do they have a chest infection? Did they have pneumonia? Did they have a heart condition? There are many things that can make children cough. So mothers just think, oh, my child is coughing, go buy cough syrup. Give cough syrup, the child will stop coughing a bit, but you have not dealt with what is causing the underlying cough. So number one, you are not treating anything, you are just delaying the evil day. So luckily most cough are due to viruses, which means that they will resolve on their own whether you treat it or not. So giving the cough syrup has not really done anything. The cough will actually stop when it is time to use to stop anyway. But the challenge we have with this method of using cough syrup, number one, is the fact that in children, when you suppress the cough, you are delaying having that child properly diagnosed. So some children can have very serious causes of cough, like pneumonia. Pneumonia kills Nigerian children. One child dies every 17 seconds. That is how bad pneumonia is. Children are dying from pneumonia. And because when children have cough, which could be due to pneumonia, mothers don't go to the hospital because they are giving them cough syrup. So please stop giving cough syrup. Your child is coughing, just watch. If the cough is really bad and continuous, they are having difficulty with breathing with it, they are having fever with it, you need to take that child to the hospital. You don't give them cough syrup. You need to take them to the hospital. Number two, why we don't like cough syrup. Most of the children, the cough syrup, what they give you are things that make children sleep. They sedate the children. They actually reduce their breathing. Children usually need to breathe through their nose and their mouth. They need to really breathe. They have to breathe to keep oxygen going. So when you give them cough syrup and they are very sick, you actually slow down their breathing. You make things worse for them. So again, these cough syrup are no good. Most of them also have very terrible side effects. Most of these cough syrup, they have terrible and children that are very young, especially the infants, less than 2 years old, they cannot talk. They cannot tell us how they're feeling. The older children, at least, if they take the cough syrup and it's giving them any unnecessary side effects, it's making their heart beat faster, it's causing them to feel somehow, they can tell us. But the younger children, they can't tell us. So we are really not even sure what is going on with them. So again, we don't like, that's why we also don't like cough syrup, because of the side effects. They slow down the children's breathing. They can't tell us what is going on with them, whether things are getting worse. And finally, which is what we are dealing with right now, this syrup can get contaminated. And this is actually, so this is what is happening now in Gambia. 66 children have died. So please stop giving your children cough syrup. If your children are ill, take them to the hospital. All right. Don't just do cough syrup right now. And actually, if you want cough syrup from India, no, 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 at this point. Okay. Unfortunately, in Nigeria, when those things come to Nigeria, they are going to repackage them. They are going to put a new name on them. They are going to write, they even put NAVDAC number. NAVDAC is already on the high alerts. Anyway, they are going and taking out all those cough syrup and everything. But please, for your own children's sake, don't give any child cough syrup at this stage, at this time, at this point in time. And generally, if you stay off cough syrup, you're not going to lose anything. And it's better for your children. I've already told you reason why we really don't even believe in cough syrup. And children, most time, when they cough, they don't bring out anything. Most time, cough syrup are what we call expectorants. So in other words, when you cough, you bring out the mucus. But children don't expectorate anyway. They always swallow their sputum. So cough syrup is actually a useless thing for children because they're not going to cough out the sputum. They are going to swallow it anyway. So it's not going to do any expectorating job and all that. So please avoid them. And some of these products contaminate not only cough syrup, they contaminate paracetamol, they contaminate these teething mixtures, especially. So all these so-called, the last episode we did with in Nigeria, it was a teething mixture called My Pekin. So now it is cough syrup in Gambia. So stay off those drugs. Don't give it to your children. I know there are names of them that have been published by WHO and Pediatric Association of Nigeria. All their names are circulating, but I'm just going to give you a blanket warning. Just stay off cough syrup for now. Anything from India, cough syrup from India, paracetamol, city mixture from there, stay off so you don't end up uh, getting our children to have a kidney injury or kidney failure. And in Nigeria, we don't even have the capacity to deal with kidney failure. We don't have the capacity. I remember that period where it was hell trying to dialyze those children. We are transferring them from Lagos to Ibadan. There are only few centers that can do dialysis in the whole of the country. So don't even go near those kind of things in Nigeria because we don't have that capacity. And that's what has happened in Gambia. 66 children this year alone has gone. So please, this is money for everybody. Tell your neighbor, all those your chemists next door, please, your auxiliary nurses that are always reading, please, this is time to stay away from those people. So before one is so let's work together and please share this
For
message. Please help us share it. Share it. I think I've shared videos from BBC, I've shared videos from W. Please help us to share it. Share it wide and let it go viral. This is the time to make sure that our children are safe because we are very worried if those products find their way to Nigeria. We know NAFDAC is there, but NAFDAC will not come to your own house. Some of you that will just go to all these women that put drugs on the counter in your streets, and please just stay away from those drugs. I beg you, in the name of God and everything you hold dear, stay away from them because it's happening next door to us now. We don't want it to get to Nigeria. I wanted to make the announcement. I forgot, but I'm happy that I remember before we finish the program so that we will all keep our children safe. We've gone through it before. We don't want to go through it again. We don't want to go through it again. So please be aware. Okay, I think we have a few more minutes and we can quickly take the last set of questions and then we can. Okay, no, I think we've answered that. Okay, we've answered this one, right?
yes, okay.
Hmm.
This is coming from Carmen Camela. She
Hmm.
said, "Doctor, we need to be aware as parents, and our behavior can affect our children' mental health. Am I right?"
Yes, definitely. Children, our behavior, and in pediatrics we call it acute, no, adverse childhood experiences, ACE. Sorry, so we call it adverse childhood experience. So in other words, when children go through traumatic experience, it affects their mental health. For example, as something as well, I won't call it simple, but the way people will look at it, like mom and dad fighting, domestic violence, children witnessing domestic violence affect children's mental health. So before you fight or abuse your partner in front of your children, think of your children's mental health seriously. So something that look like some people don't even think about it, but it's very serious. So when children go through this experience where they are scared, or when they are scared of parents attacking each other, when they are, or even things they watch, like some of these programs on TV, some of them are not meant for children to watch. It can affect them, psychologically, can affect their mental health. The fact that children don't have a stable family life, like the same mother or the same, today they are here, tomorrow another person is there, those things can affect our children. So all these issues are very important for us to remember and to also model good behavior in front of our children. So I hope that's helpful. uh, uh, for cough, my grandma was always giving us tea made from onions and always so fast. Anyway, the thing about cough and all that is that cough is just a symptom, it's just a reflex. Cough is just the body trying to clear out anything that is irritating the airway, any foreign body in the airway or anything irritating the airway. It's actually a good reflex. It's only when it becomes persistent that it becomes annoying and So, and for us, the issue is what is causing the cough. Let's go for that and not the cough itself, because cough is actually a way of helping us to know there's something is irritating that airway, or there's something foreign in that airway, we need to get rid of it. So suppressing cough or giving cough syrup is not the solution, but to address the underlying cause of the cough itself. I hope that's helpful. uh Somebody, what else can I do? Okay, I think let me just answer the question on Instagram, and then we can close. Yeah, so Lua Fola community, someone that was diagnosed of depression and anxiety attack, apart from the, I'm not sure I understand your question, Lua Folakumi. Are you asking the management of depression and anxiety apart from the drugs? Or I'm not sure. Yeah, there are other supportive measures for these mental health issues apart from drugs. So, but the psychiatrist or the mental health practitioner, they will tell you that when you go for that. Belisuga say, thanks, Doc. Okay, I guess you had one ask question about complementary feeding. I started him on Nutribon and pick 01 to 12 and PAP. Again, I always tell parents before you start complementary feeding, go and watch our complementary feeding video. Complementary feeding does not mean you need to put your child on formula. No, it is not formula feeding. You don't have to even start any formula when you start complementary feeding. And when you want to start, and you don't have to buy things from the shops, you don't have to buy so-called baby cereals or food that have been mixed together. You avoid them, especially those of them that are mixed. Especially when you're starting children on complementary feeding. I know a lot of Nigerian mothers go for Nutribon. I always advise against it. Why? Because I'm not trying to put down anybody's product, but I need to let you know the principle behind complementary feeding. You don't give mixed products when you are just starting something, because you will never know if your child is going to be allergic to any of them. So all those products where they already mix this, mix that, it's a no. When you are starting at 6 months, it's a no. You don't start with them. And most of the food that you need to give your baby when you're starting complementary feeding, they are food you have in your own kitchen. That is what you need to give. You don't need to buy something from the store and quickly mix it and be giving. No, you don't have to. You can use the food that you have in your own kitchen, your pap, your rice, your yam, your potato. There are things you can mash, there are things you can cook very soft, and that's what you give. And when you want to give food for the very first time you are giving any food new, it has to be given singly, just it alone, and you have to give just a small quantity, maybe just 1 spoon, 2 spoons, and watch, because you need to be sure that child is not going to react to it. It's after the first day of feeding is just 1 spoon or 3 spoons, that's all. But at least you now know that this child can take pap without reaction. You may want to add egg next time, and then you know that pap and egg, my child can take them without any reaction. Your breast milk is still the milk that your baby needs to go on the complementary feeding. You don't necessarily need to buy formula. So you have to remember that. But if you are the type that you're not even doing breastfeeding before, you are using formula before, fine, you can use the formula. But please, when you're giving the formula, make sure you mix it according to the way it should be mixed. So the right amount of scoops to the right amount of water is very, very important. So these are all principles behind complementary feeding. We need to get it right. If you don't get it right, it's not just to buy something, mix and give the children. You need to understand why we do what we're doing and how to do it. And everything is progressive and it's gradually. And the quantity is also gradual. You don't give them the same way you're giving them formula like 4 times a day. You also give them complementary 4 times a day. No, it is not, because their main food is still going to be the breast milk, and you are now adding the solid. So usually for the 6 months, just need like 2 feeds a day of complementary feeds, and quantity I've already mentioned that you have to, and then the texture is very important as well. So luckily, Global Health Media, they have done a lot of videos for complementary feeding. So every day, every time I'm online, I'm always talking about complementary feeding videos. The videos are available on YouTube. They are available on our Facebook group. They are available on a app, Beyond Birth and Beyond app. which you can download. They are available in multiple languages. Before you start complementary feeding for your babies, you need to have that knowledge. I noticed that mothers that have the knowledge, then they go through complementary feeding, they are just flying through it because you already know the principles, you already go through it. But when you just, okay, people just think complementary feeding is just go and I now need to start giving formula, or I need to go and buy something from the store and I need to start mixing and give it to my baby. You're going to run into trouble along the way. So just stop. Your baby is 6 months. There's nothing to worry about. Go back, watch all those videos, understand the principles, what to give, how to give it, how often you give it, what are the things that go into what you're giving. When you understand all that and you now follow it through, you will now um you'll be comfortable. So for products that are mixed with different things, each of the items must have been given to your baby alone, singly, before you now begin to give them as mixed, because that's the only way you are now sure that your children are not allergic to them. So they are not literally the first thing you start with. There are things you give further down the line when you've tried all the various things, then it is okay to now mix them together. I hope that is helpful. So this is not complementary feeding videos topic, but we have so many resources on complementary feeding. I have a podcast on it. We have it on our website. We have lots of videos on it. So it's one of the most frequently asked questions on Ask the Pediatrician. So definitely we have enough resources to help. So get that resource, get it, go through it, and then correct any little error here and there, and you'll be fine. So your baby should not be constipated when on complementary feeding if we are doing it right. So we need to just understand that first. All right, I think it's time up. So, Jama,
Yeah,
yeah,
it's
that what?
7:01 and we are almost 1 minute behind the scheduled time. It's a wonderful time discussing mental health, which we all need to take serious. It's a serious thing, a very serious one. Like you said earlier, once you mention the word mental, or once they hear you want to go and visit the psychiatrist, the next thing is, this person is running mad. Typical African Nigerian mentality. I hope we get it right someday. That it's not all about going mad and the others. It's about keeping at alert our mental states, which is very, very important. Thank you very much, Dr. Bemisola. We really
Thank you.
appreciate you. And
Yeah,
thanks to our viewers from the Instagram page, from Facebook, our friends from UK, Qatar, and the ones here from Nigeria. Thanks for coming around. Hope to see more of you in our subsequent live session. And if you still have any other questions pertaining to your child health or your own personal health, you can follow us on Facebook and ask your question. Believe you me, the same Dr. Gbemisola and some other doctors are there to attend to your questions anytime, any day you drop the question. Follow us on all our social media and you can watch our previous episode on different topics that has been discussed so far, and YouTube as well. They are there waiting for you. The complementary feeding, the flu and cold, they are there. You can read as many as you can. And if you want a one-on-one session, there is a number to call in as well to book a session, which they are all available 24/7 to attend to you. Thank you once again for coming to the live session. We really appreciate your time. Dr. Gbemisola, thank you once again.
yeah. Thank you, everyone. So have a wonderful evening. Enjoy the rest of your holidays. And like Ijama said, if you have any question, you can still always post them on our groups and Monday to Saturdays, and somebody will be there to answer your questions. So thank you so much for joining us. We'll see you again same time next week.
All
It's
right,
bye.
bye.
Bye.